Very good. Well, it's a great pleasure to talk to you all today. Today actually is my 60th birthday to the day, October 3rd. And I couldn't think of a better way to start the day by starting on this new initiative on analytics for a better world, something that I have aspired to do since I was in my early 20s. So particularly pleased to talk to you about this. So I decided to talk to you about, in some more detail, about a project that I have been occupied my attention for quite some time, how to improve healthcare systems using predictive analytics. And this is work I have done with my group at MIT and also Harvard healthcare system. So let me perhaps talk to you about the organization. The organization, the majority of the hospitals in the United States are non-profit. So Harvard healthcare system is the largest hospital system in the state of Connecticut, which is near New York. It has 7 diverse hospitals, ranging from large academic hospitals to community hospitals, from large to small. Altogether, the system has about 2,500 beds. So it provides service to about up to 2,500 beds patients a day. It's a representative type of hospital for a US network, and it's a sizable entity. It has operating revenue of about 5 billion, as I mentioned. This is not a profit organization. So we have worked quite closely with this hospital, and the questions we are asking are a variety of questions. Today I will focus on the predictive ones, but we have also done prescriptive questions. Let me start by what type of questions we are asking. So we have data on a daily basis on patients, for every patient in the hospital. The type of data we have are the patient status, the clinical measurements, for example, how much oxygenation they get, the mental status, and so forth, various laboratory results, as well as demographics, other socioeconomic data. And so given this information, which we receive daily from all the patients in the hospital, about 2,500 beds, we try to predict a variety of things. And we try to predict it twice a day, in the morning for the morning rounds, in the afternoon. And specifically, we try to predict whether somebody is close to being discharged, is predicted to be discharged 24 hours in the future or 48 hours in the future. That's particularly helpful because it can decrease the length of stay, and this improves the organization significantly. We also try to predict the final destination, whether this is a rehabilitation center, whether this is another facility, whether this might be home, and so forth. We also predict mortality risk on every patient. Every 12 hours, we predict whether this patient's mortality is decreasing or increasing. And this is particularly relevant to warn about possible deterioration. In addition, we also predict whether a patient would require an ICU, this is the intensive care unit, in the next 24 or 48 hours. And this is particularly relevant to allocate the very scarce hospital resources. The ICU is definitely a very scarce resource. And let me tell you what is the importance of these questions. First, on the length of stay, I'll show you some evidence that while during the system has been applied, it's now operational in the system, which is for those of you that have experience in applying things in the real world, it's not an easy task because you deal with daily with thousands of doctors and nurses. You need to listen to them, you need to get feedback from them, and so forth. So this has been operational. we have a particular process of getting the data and so forth. I won't bother you with this. In terms of practical, what is the scientific evidence that this is a good idea? We utilize machine learning for these predictions. And we have observed that across all 7 hospitals, this Hartford Hospital, the main hospital at 900 beds is HH Hartford Hospital. The accuracy of these methods, something that is called the area under the curve, the details are not so important, are quite high. It's of the order of 85%. Not perfect, of course. I say often that perfection is outside the human condition, but it's across the board strong, and the fact that the strength of the methods convinced the leadership at the hospital system to utilize it. In addition, the predictions we make and the reality is very close. So when we predict that somebody has probability of leaving the hospital, 40%, it's approximately 40%. In other words, it's very well calibrated approach. We're quite happy about that. We also have been engaged in significant implementations and feedback with the doctors. For 2 years, we had and continue to have weekly meetings with physicians and nurses to hear what they say and adjust the project on a weekly basis. So here's an example of the software. For every patient, every row here is a patient. This is from February 22. We have a prediction about mortality. We have a prediction about the probability of mortality from yesterday. And the way this was helpful is because at least in 2 occasions that I remember, we detected that somebody's mortality probability increased significantly from one day to the next, from 10% to 15, 16%, which is still, you might say, low, but given the outcome of mortality, that was significant. The system alerted the doctors, and they found out in both cases that the patients had sepsis, although it was undetected. So I believe the fact that we detected as early as we can, typically we detected it a few days earlier, we, I think, saved their lives, because the sepsis is the kind of disease that if is an infection that if it happens, if you detect it late, a large number of the patients actually die. This is on the mortality side. And then we demonstrate whether the probability going up or down. We also have the destination probability, the ICU, and so forth. And we also utilize colors to demonstrate and to alert humans. Green means the patient is ready to expected to leave in 2 days, within 2 days. Yellow is that positive, but not yet ready, but ready to prepare. And red is primarily about mortality. The medical situation of the patient decreases. So, and another aspect of it is we utilize also another application of machine learning. If somebody clicks and then says, what is the reason the probability is 90%? It shows you the factors that contribute to that estimation. So it makes the probabilities more understandable to humans, doctors, and nurses. So this is for everything that we do. In terms of how the machines improve on the machine learning approach, improve on relative to human predictions, I would say it's quite sizable. It's of the order of 20% improved accuracy, as you can see. So 18.6%. Because we have live comparisons, because everybody who enters, the doctors make a prediction, and the computers make the prediction, so that's directly comparable. Correspondingly, we have been using it for about a year now. Correspondingly, slowly, this improvement has convinced the medical personnel to utilize the system. And this is an example of the feedback we have received on a weekly basis to the day. We received areas where, in the human opinion and the opinion of the machines varies. And we have found that that this has improved dramatically the system in a way that on various ways, in such a way that the overall accuracy went up from 78% initially to 83, 84 that it is now in the particular hospital. So collaborating with the doctors improve the accuracy, but also improve, they now feel owners of the system. And the overall length of stay for the areas that utilize our system has decreased 4% from 2021 to 2022, whereas for the rest of the hospital, it increased 7%. This was during the later parts of the COVID period. So traffic has increased in the hospital. So the difference was about 11% reduction, which roughly is from 5.5 days to about maybe 4.8 days. This got also significant financial improvements for the hospital, because now you can serve more people, and also you can take care of more people. And I have also 2 or 3 slides on an exciting new area that we have been doing that I believe will be increasingly important. I call it HAIM, Holistic Artificial Intelligence for Medicine. It's a Jewish word for life. The paper just appeared in Nature Digital Medicine, which is one of the Nature journals. And its vision is a very simple one, but I think an important one, is to combine what's called multimodal data, scans like X-rays, MRIs, CT scans, reports like radiology reports, doctor and human notes, tabular data, but these are very distinct structured and unstructured data, and to use a holistic perspective of AI, namely computer vision, natural language processing, and machine learning together, to improve the ability of models to make predictions and prescriptions in medical outcomes. We have developed this and have pipeline. The pipeline, we have the code that's available in the publication. It is open source, as mentioned earlier. And we have observed that mortality predictions improves significantly when you combine various data sources. Disease classification also improves significantly, and length of stay improves significantly. In other words, combining different nodes, different modes, improves overall prediction. And we currently work on a variety of applications of utilizing the HAIM technology in a variety of settings, detecting domestic abuse at the local hospital in Boston. So these are patients that come to the hospital, they have X-rays, they have reports, they have notes from nurses. We take all of this into account and we predict whether the probability that they are actually under domestic abuse situation. Detecting human trafficking also. Human trafficking across the globe is an important, very important topic, and being able to detect the accurate importance of HAIM technology is important in that way. To predict, for example, very serious events at hospitals that might threaten somebody's life, utilizing images like X-rays, CT scans, MRIs, notes, as well as lab results. We have built an application that warns of upcoming such events and tries to deploy teams that help come closer, and even half a minute might save somebody's life. The area, of course, is endless. I could go on in oncology, in strokes, and so forth. I'm very excited about this area because I think its promise is, because humans, definitely in the medicine area, but many others, agriculture as well. For example, another application of this technology is in agriculture, in which we utilize satellite information, meteorological information, information from the ground to make predictions about yield, agricultural yield, rotation of the crops, what crops to use at what times in the year, and so forth. But also, we are also working with Ivory Coast in Africa to help the government have a better control of its crops. That's a significant. This is primarily an agricultural economy, so we are hoping that this would overall help the economies around the world. The most important thing to remind you is that the use of data of various forms, in my view, is going to be increasingly. We are beginning to start to know what to do about it, but I have high hopes that these ideas will be relevant, and particularly relevant for analytics of a better world. So with these notes, I would like to thank you for your attention. Hopefully you got a sense of what I'm doing, and if there are some questions you would like me to entertain, I'm glad to do it. Thank you again.